Hi, Michelle. Thank you for joining me. Hi, Jamie. Thank you for all the blue hearts. Hi, Star. Hi, Priscilla. All right. Okay, had a little technical difficulty, but I think I fixed it. Looks like everything's working. Y'all can see and hear me, so. Um, who's that? Hi, Stephanie. That's awesome, Jamie. All right. So today we're talking about alternative jobs because I was gonna film that, but I have been very busy, so I did not get a chance to, and so I'm gonna talk about it live. I figured that might be better for some folks because when you're looking for a job in medical coding, obviously you're gonna run into the whole thing of everybody wants experience, and we'll talk about that here in a minute. But sometimes people just look for one job title, medical coder. That's what they want to do. Not knowing that medical coders are called different names. So, one, it is very important to broaden your search by looking at specific other names and then taking the time to read the job descriptions so that way you can kind of like piece together what is what. Because I know some, but I don't know them all because I don't know every employer in the world. People call their medical coders different names. Some places call their medical coders revenue cycle technicians, which when I hear revenue cycle, I think of billing. I don't think of coding when I think of that. And then some of them call their medical coders medical records technicians. Again, not something I'm connecting with coding. And then some people call them like health information specialists and things like that. So there's a myriad of names we get called. So I'm going to talk about some alternative names as well and some alternative jobs because the important thing about getting started is to get started, all right? And the sooner that you can get yourself a job, obviously the better. But there are some jobs that are better than others at getting you some experience to put onto your resume. So while it may not be the job title of medical coder, it will probably, these ones that I'm talking about today, will get you some exposure to the codes. They often do not require a certification at all. So you go strolling up in there with a certification, you're going to look even better, right? So that's the thing that I want to talk about today. So let me see. All right. Hi, Stephanie. Um, Hi, A. Hi, Sherry. Hi, Galaxy. Hi, Anna. And hi, Marie. They make the print so light against the background. I think I probably need to change the background so that I can see it. So anyway, alternative jobs for new medical coders. All right. The first place that you can start off at is the insurance companies, right? Blue Cross Blue Shield and Aetna are the two that I am going to recommend. I am not going to talk about any other insurer. No other insurer can I say, oh yeah, that's a good company. I'm talking about two big ones, Blue Cross Blue Shield and Aetna, because I know both of them have lots of remote work for my people who insist on working remotely right away. Well, this is one way you could do it. So Blue Cross Blue Shield and Aetna both hire people who review the claims. They call them claims reviewer, they call them claims processor, insurance claim reviewer, that kind of thing. But when you read the job description, make sure it's not like a nurse type position that you're trying to apply for, because that's not what you want. You want something that they're processing the claims that are coming in. So what happens when you do a claims processor position or something along those similar lines of that kind of title is you're looking at the claim that's coming in from the doctor's office. Often you're running it through an encoder. An encoder is an electronic code book, and it's got things that pop up called edits. So, for example, if there's a mismatch, this is a female patient, and the female patient has a male diagnosis, it's going to flag something's wrong with this. And so we need to review it again. So it could have been just an error, like a slip of the finger, and okay, it was just a mistake. So that claim would get denied, and then you would put the reason why, and there's a code, okay, because they have the insurance has different codes for whatever, and so that's what you would send back to the doctor's office, and so they would either correct it or accept it or whatever the case may be. So, but that's your job as a claims processor. The great thing about that is, number one, you're getting exposed to codes. Now, before some of you say, well, that's not coding, okay, but you are having to apply knowledge about sequencing. You are having to apply the coding guidelines and the rules and things like that. So while you may not be selecting the codes, you do have exposure to the codes. And so that's very important, especially when you're trying to get out there and find your first job as a coder. If you've already had that experience of working for example, Blue Cross Blue Shield, and you say, well, I was a claims processor for Blue Cross Blue Shield, and then they say, okay, well, you processed this many claims. You looked at all of these codes and you verified that they were correct, and then you looked at the edits, right? Whatever edit was coming up, and then you processed it from there. So that's something that's going to be very valuable for your resume. It gives you something to put on there that you've had exposure to these codes, because you've been having to, use your brain and your knowledge of coding in order to make that either approved or, denied, whatever the case may be. But you have the knowledge as a coder, as a certified coder, to say yay or nay. All right. And even if it's your first job out of the gate, okay, we just need to know the rules. The tools, the electronic tools, are there to help you. All right. But you still have to use critical thinking. And again, it is going to give you that exposure, and it is going to help you. Not only that, you're going to get exposure to the electronic health record, which is another plus, because then you're going to be able to have that on your resume as well. For those of you that are concerned, like, I don't have any experience with the electronic health record, how am I supposed to get it? And there's nothing online that I can study. Every hospital, every healthcare organization is different in that they have different packages. Epic being one of the biggest ones. I have never personally worked with Epic, but I do know that they have different packages for different facilities. Why? Because different facilities have a different patient population. They serve, like, some are for pediatric patients, some are geriatric patients, and some is a mix of everybody. So, depending on what it is, and some hospitals are not going to see thousands of patients. Some hospitals are going to see maybe a few hundred patients. So it really all depends. And then some are going to see thousands of patients. So that's what you have to know. So because of that, every place is different. You're going to have some that the electronic health record may be the same that you've worked in, but it's going to look a little bit different because they have a different package. So facilities are usually okay with training on the electronic health record part, because you need to know how their system works. But what they will not do is train you on coding. And so if you're thinking that you're coming in with, oh, well, they told me at the school that I was going to get on the job training, they lied. Because a lot of times they're going to expect you to already know what you're doing. When I started here at my forever home, that was literally the first thing that my boss told the three of us that started that were new. This is not a training ground. If you need help, obviously ask, but you need to have already made sure that you've gone through the guidelines, done all of your research through AHA Coding Clinic and CPT Assistant. You need to go through all of that before you come to me. Because if you ask me a question that is really simple, she says, I am not going to be patient with you. No problem. No problem at all. So you learn really fast. I'm a researcher anyway, and I was already used to that. But for anybody else who came in expecting that they were going to get their hand held, it was a really rude wake-up call, because this is the real world and that's not how this works. So that was the end of that. But With that said, that's what you need to be prepared for, okay? And getting a job like a claims processor or claims reviewer for Blue Cross Blue Shield or Aetna, do not ask me about the other ones. Do not ask me. Blue Cross Blue Shield or Aetna. I have to say it like this because last time it was a huge thing, and I don't want to make it a huge thing again. Blue Cross Blue Shield or Aetna. You can go online to their website. And if you scroll all the way to the bottom, they usually have a tab where it says careers. And then that's where you can click on to see, what positions they're hiring for. Okay. So sometimes they are very specific about where you live. Okay. So if you want to do this because you want to work remotely, just keep in mind that they need you to be in a certain place. If you say that you live in Texas and they say, yes, we hire people who are in Texas, great. If you live somewhere else, and let's just say, for example, you live in Alaska and they say, we only hire people in Texas, and you try to apply and you're in Alaska, you're going to get denied. And then that's just going to be one more frustration that you have. Don't frustrate yourselves, folks. Pay attention to what they have in those job listings. Okay, so that being said, claims reviewer, claims processor for the insurance company. That is what we call working for the dark side because you're working on the insurance side. But all of that skill and all of that experience, that's going to be very helpful for you to put onto your resume. And just because you start there does not mean you have to stay there. If you want to stay there a few months and then keep looking, that's totally fine. If you want to start there and then, hey, I like this, and you decide you want to stay there, then by all means you do what is best for you. But this is a good way to get started and using your coding skill without having to sit here and wait and then wonder, how long is it going to take you for you to get a job in coding. All right. So there's that one. There's prior authorizations, which prior authorizations is not coding, but it gives you exposure to the codes. It gets you exposure to the documentation. It gets you exposure to the electronic health record. Now, some of these positions might require you to be at the facility. I don't want to hear it, guys. If you want to work remotely, that please don't tell me. I can't. Not anymore. Not the rest of this year. Okay, please, because it is so critical that when you are brand new as a medical coder, that you spend a little bit of time. I'm not even asking y'all to be at the facility for a year, even though that would really benefit you. I am just asking for you to be there at least 3 months. 3 months is going to get you exposure to other coders. It is going to get you around other people that could potentially help you in your quest to find another job or to learn something else or whatever the case may be, like get more in-depth learning on evaluation and management, whatever, because you're in person. This is just temporary, all right? It is not forever. It is just temporary to get you started because the book and the real world are two different things. You learn academically what goes on when you're in book world. When you are in the real world, then you're going to start learning about providers, the way that they document, their use of terminology that is so foreign to you because it is brand new, but you will learn it. It will take some time. Sometimes they use abbreviations they're not supposed to, and you will learn about that on the job, okay? But the important thing is that you take this time to be in person so that you can learn in person. There's a lot of online learning and all this stuff. It is really hurting the education system, honestly, because not being in person takes out that little bit of element of learning. And you need that because I've said it before here on the channel is that I have to punch up my voice. I have to punch up my energy when I'm on camera, because if I was to talk like normal, people would be like, what's wrong with her? Why does she seem so down? Because the camera takes you down a couple pegs. Okay. It does something where you feel like you're very energetic, but what comes out on camera is something completely different. So that's the thing. It's the same thing with education. And if you have somebody, it's not in front of you, it's really easy to get distracted with whatever else is going on. And then people are confused sometimes, if you're in a virtual class And then they may have something in the background, or they have dogs barking, or kids screaming and playing out in the back, no. And so that gets very distracting versus being in person where you don't, those distractions are minimized. I'm not saying that they don't exist, but they are minimized when you are in person, because it's real easy to kind of give that energy to that person, like, hey, I need you to pay attention. And so that's a thing. Being in person is going to be very beneficial for you. Yes, working at home is great if you have experience. I was 6 years in when I first started working at home. I had my very first job working as a level one trauma um, medical coder, and that was a very interesting experience. But if I had not had the experience of being in person and learning, I would have been really a fish out of water in that situation. But that's why I'm telling you guys, it's very important that you work in person first, 3 months minimum, guys, 3 months minimum, and then you can go home. But get that exposure to other people. And so that way that can help you. It doesn't matter what your situation is, guys. Because I will get people who will tell me, oh, but my situation is this. It literally doesn't matter to me. My advice is literally the same for everybody, just to help you. I'm trying to help you. Okay. So with that said, we want a prior authorizations position as our alternative to medical coding. We want a claims reviewer or claims processor that will help us on our journey to medical coding. There's also a medical biller position. Now, there's a lot of people who say, well, I absolutely don't want to do medical billing, because you think that you have to do like the calls for, like, telling them about their bill and things like that. Some places do, yes, that's what they do. And then others, believe it or not, they don't make collection calls. They don't. They literally just bill, process. They talk to no patients, but that is very specific. And so you have to look and see what the job requirements are. So don't fool the billing positions because you think you're assuming that that's what it is, because it's not always the case. Sometimes they are literally just processing what's out there, and then that's it. They don't make no collection calls because for whatever reason. So that's something that you guys got to keep in mind. You still doing billing is going to help you to get that exposure to codes, because I've had billers who say that too. Well, Blue, I'm just a biller. I don't do the coding. Okay. Is there a coder in your office? No. Okay, so when you have denials, what happens? Oh, well, I look at it and I figure out what the problem is, and I research the code, and then I change it, and then I submit it again. Okay, so what did you just do there? I just fixed it. No, you coded. Now you didn't select it because the provider selected it initially, and you process it like you're supposed to, but you're the one who's looking at it when it's coming back, and you're having to figure out what the issue is, and you're having to consult the code book, the guidelines, and all this stuff to make sure that you have the correct code. That's coding. And so some people try to think of what they do and put it in a box. That's not the way that this goes. You can't think of yourself like that. Now, you can't say, oh yeah, I did all this coding. No, but you did do denials management, which is coding. Okay, so that's what you explain on your resume. All right, who's laughing? What's going on? All right, let's see. Looking for jobs. What some places call medical coder. Blah, 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 blah. I don't know why we have the giggles. All right, hi April. Working in person never hurt nobody. It will only help you. I currently work remote for a job I do, but I worked in an office for 1.5 years, and that was the required time was 6 months, but that was my choice. I still go in from time to time for meetings and things like that. There you go. There you go. And again, it's just beneficial for y'all. I mean, I know y'all think it's glamorous. If you've never done it, you think it's glamorous, but it takes a lot of self-discipline because there's nobody looking over your shoulder. And while you may think that's so great, because some of us can handle it, some of us can't. There are some people that they have to have somebody directing them to tell them what to do, so that, okay, well, no one said to do this, and I'm just sitting here with no direction. There are some people that are like that. I mean, if that's the way that you are, that's the way that you are. I mean, people are different, and there's some people that they know they're assigned to this clinic, this is what they do, and they get started, and no big deal. But again, if you are one of those ones, you got to be real honest with yourself. And there's sometimes not, people are not honest with themselves when they're looking at the situation, like what would be best for you. But I'm telling new coders, period, flat out, that your best thing is to start in a place so that you can get that hands-on learning. Just saying. So, all right. So we have billing. Okay. So billing, again, that will help you. I mean, the great thing about billing is that there's so much transferable skill there. You were exposed to the codes, you did denials management, and not only that, specifically about government health plans, and you also know about commercial insurance. There's a difference, okay? And so there's a difference in how they do things. Who better than a biller to know about Medicare? Lots of people take Medicare, Medicaid, and knowing those rules, and you coming in there as a coder or trying to apply as a coder with that knowledge, there's nothing better, because you're going to know immediately, okay, these are Medicare patients. The biller's going to know, hey, Medicare patients are billed with a G code when they're doing the colonoscopies, the screening colonoscopies, because they have, your standard screening colonoscopy, your regular risk, and then they have the high risk colonoscopies, and those are the G codes. If you have commercial insurance, you're not going to be reporting those, right? Commercial insurance, they have the CPT codes for those, but Medicare reports G codes. And so a biller knowing that, strolling up into the gastro clinic, hey, I used to be a biller, and I know that we got to do, who better than you? I'm just saying. So coders should know that, but that is a billing thing. So billers are going to know those things. They're going to know things specific to commercial insurance. They're going to know things specific to government plans. So that's what's going to set you apart. We need to look at our skills that we have been gaining, and we need to put them out there so that the people understand that this is what we did. Because I've had people who, they show me their resume and I'm like, you did billing? Yes. I see nothing about their exposure to Medicare, to Medicaid, to, the commercial insurances. I see nothing. And I have to draw it out of them. What did you do? Okay, why isn't this here? I don't know this. I don't know what you do as a biller. And I'm not going to assume. But the more we have on here, specific details, that's what's going to make you look good. And you doing the denials management, going to make you look even better, because you weren't just sending in claims and then if it got denied, oh well, you were actually making sure that money got recouped. And so that's very, very important. So, all right. All right. So, now that we got all that out of the way, the billing, prior authorizations, and working on the insurance side, those are the ones we want to go for, okay? You want to stay away from reception, front desk check-in, patient access. These are not going to use your skill in coding. Oh, yes, Blue, I'm a secretary and they let me code. Okay, so what they let you do is have two hats. They're running you ragged and having you do two things instead of just the one. You're getting paid as a secretary. You're not getting paid as a coder. You're not getting paid as a coder. And worse yet, you want to add more insult to injury, is that you are certified. Either you paid for it or you got a scholarship and you paid for it in time, but you paid for it. And now they're getting your skill basically for free, because a secretary, medical secretary, is a different skill set. Your skill set is more complex because you have coding training. You have a certification, all right? Assuming that you have your certification already. If you don't have a certification, you need to get your certification. Don't sit there and wait. Okay? Don't wait too long. Study, do your 20 hours per week, okay? Get yourself prepared and then go take your certification exam. You can apply without a medical coding certification. Maybe you say, "Well, Blue, I can't afford the certification right now. I just need to get started working and then I'll get my certification." Okay. If you apply at a place and they agree to let you on, right? This person is almost ready to take their test, but they just need to work so that they can get money so they can pay for their certification exam. If you do that, they do not have to pay you what they pay a certified medical coder. Just know that. They will hire you, but they do not have to pay you what they pay a coder. They do not have to keep you if you cannot pass your certification exam. Sometimes they will give you 3 months, sometimes they'll give you a whole year. One lady told me that they gave her 2 years to get her certification, which is fantastic, but a little long though, right? And so that's something else you got to keep in mind. Don't wait till the last minute to be trying to take your certification exam and then expect to do well on that test when you're stressing yourself out and you can't think because you're worried about losing your job because you can't pass the test. Make sure that you take it, all right? Don't put that pressure on yourself. And again, these employers are going to pay as little as possible if you allow them. So that's why you want to make sure that when you're out there, you're arming yourself with the appropriate credential. All you need is one. You do not need two. All you need is one. If you look in the job listings, it will tell you. All you need is one. Candidate must be certified through AHIMA or AAPC. That's it. You only need one. You do not need two. All right. So, with that said, let's see. I see a comment. Okay. So, we talked about that. We talked about that. We talked about the billing. Be flexible where you start. Just be flexible. Those that are out there seeking jobs and they are very insistent that they want something remotely, they want this, they want that, or they want to be a psych coder, right? They only want to work in psych. Again, you're hurting yourself because you're limiting wherever you're going to apply. People who apply at the emergency department, at urgent care centers, at dialysis centers, at nursing homes, these have plenty of diagnoses you can play with. Lots and lots of different procedures and things like that, except for the dialysis center, right? But with the exception of the dialysis center, if you're applying at an emergency department, urgent care center, or what's it, the nursing home, they have plenty of diagnosis for you to work with. They have lots and lots of procedures that they do, especially in the emergency department. And that is going to get you your exposure to the different specialties. When you have exposure to different specialties, then you get to see what you want to apply for next. Not that you need to be a specialty coder, because a lot of people get caught up in that. You don't need to. Okay, guys? Don't worry about all that. When you're in your first 2 years of coding, you need only one certification. And trust me, that keeps everything very simple. You're not having to worry about multiple credentials, getting all these CEUs when you're trying to start in your first job. Some places will give you CEUs as a benefit of employment continuing education units. CEUs are meant to keep up your credential. Every 2 years for AHIMA or AAPC, you have to meet the number of continuing education units, CEUs, for your credential. If you have one and you're with the American Health Information Management Association, you have the CCS, CCA, or CCSP, you only need 20. If you're with AAPC and you're starting out, you have their flagship credential, the CPC, that is 36 for one. Okay. Now, with their membership, they do include CEUs. Their membership is mandatory with AAPC. With AHIMA, it is not mandatory, but it really all depends on which one you're going with. Okay. They do include CEUs with their membership with AAPC, and like I said, AHIMA does too. But just know that if you're going to tack on additional credentials, it's not going to cover everything. Okay, this is why I'm telling you, all you need is one. All you need is one. And if you ever find an employer that demands new coders have multiple credentials, that's not the place for you. I'm just saying, it's not the place for you. Okay, so, but yes, that is my advice, is that you look at different places to apply. Don't just, oh, I only want to work here. Consider other places, dialysis centers, laboratories, okay, like Quest. If you have like a Quest Diagnostics in your area, plenty of coders work for Quest. Although I will say the thing about Quest is that your procedure exposure is going to be very limited because it is just literally the lab codes, the 80,000 series codes. And for some people, they don't like that one. So, but again, it's exposure. It's something to get you going. Some people will talk about HCC coding, the hierarchical condition category coding. Now, the thing about HCC coding, I tell people if you're going to start there, it is just diagnosis coding. A lot of people get excited about that. And they say, well, that means I don't have to work with CPT. I don't have to do E&M. That's great for me. And I can get started and I can make all this money. The thing about HCC is that it can stunt your growth. Why? Because it is just diagnosis coding. That's it. When you do not apply CPT, and the vast majority of you will stop studying because it's a lot to work, right? It's a lot to work 40 hours a week. But when you are only doing diagnosis coding, you forget the CPT coding. And when you forget the CPT coding, and then you stay in HCC for 4 years, it is very difficult for an employer to even want to give you a chance because, yes, while you have 4 years of experience, your experience has only been diagnosis coding. And for those of you that want to get fresh and tell me, oh no, Blue, we have CPT for ours, that we report to. Okay, for HCC, okay. But if you look at the description for HCC, traditional HCC is just diagnosis coding. If you are doing CPT coding with this diagnosis coding and they're still calling it HCC, that is not HCC coding. That is something completely different. I don't know what that is, and I don't know what they're trying to pull. But if you look at your ICD-10-CM book, if you have the Optum ICD-10-CM Expert for Physicians, in the back it talks about HCC. It is traditionally a diagnosis project, right? What they're doing is they're collecting diagnosis codes, and Medicare was the one who started this. They use this data to get it into an algorithm to figure out how much is it going to cost to take care of an aging population. Because if this aging population has this diagnosis and this diagnosis, there's a good chance that they're also going to have this diagnosis and this diagnosis. And so when we have somebody who has this combination of these diagnoses plus this, that's how much this is going to cost. That is HCC. That is the whole purpose of HCC coding, okay, is to get that information. It is statistical. That is the very heart, the very essence of statistical gathering of information is when they're doing HCC, okay? So again, if you're doing something else and they're adding on CPT, that's something completely different. That is not HCC, okay? But That is what HCC coders do. They only work with diagnosis codes. And you don't want to get yourself trapped in something like that, because it does get boring very fast. Because while you're doing a lot of combination coding, and it's great to have, because this is very important information that we need to collect in order to be able to plan, right? Uh, it's very important to have this, but at the same time, you want to make sure that you are still practicing CPT, that you're not losing your skill, because it is very easy to lose your skill. And again, if you are having 4 years of only diagnosis coding, they are not going to want to take a chance on you. And you better be charming as heck in order to get a position, because that's what it's going to take at that point. Because if you, again, if you haven't had exposure and you can't pass an assessment test, you're really not getting in. So always make sure that you keep up on your skill no matter where you're at, so that way you can move if you need to. You never know. I mean, there was people who, like, a lot of people, I think it was last year or maybe it was the year before, they were all HCC coders, and then a bunch of them got cut. And so they came to me, they're like, Blue, what do I do? I've only been doing this for 6 months and I've forgotten how to do CPT. Well, you better go back to that CPT book, right? You better get back to that CPT book. You better start practicing. You better start looking at those guidelines again, because that's what you got to do in order to get out there. You're lucky that it was only 6 months and it wasn't a year that you were in there, because if it was, then you would really be hurting. But at least this way it's 6 months, because I tell people, if you're going to go the HCC route, 4 to 6 months max. Get out of there. Okay, get out of there. Get from that what you need, which is learning how to abstract codes, right? Pull out diagnosis codes that you see, and of course using combination codes, and the electronic health record. Okay, getting that exposure to the electronic health record. That is what's going to help you, and that's going to put failure on your resume. Okay, so that way, okay, now we've got something to look at, because once you get one job, just getting one job is going to change everything. And that one job does not have to be 2 years, because like these employers will ask, oh, candidate must have 2 to 3 years experience. It doesn't even have to be that long. It just needs to be somebody else needs to have gotten you before they'll consider you. Okay, not to say that you can't get a job, just because you're brand new. No, I say it all the time. Yes, you can. But we need to make sure that we're talking about our skills correctly, the right way, and not that we're out here, putting on our skills list, oh, we're organized, we're a team player, and we have a smiling face. Because if I see that, that's going into the pile that I'm not going to call, because you didn't do what you were supposed to do. The skills list on your resume is very critical, because that's telling the viewer who's looking at it, what skills are you coming in with? If you can't tell me what the basic skills that you have are, medical terminology, anatomy, and patho, if you can't tell me that, if you can't tell me all these other things, what are you putting there? Organized, team player. Everybody's organized. Everybody's a team player. When you're out there looking for a job, you ever seen somebody say I can't work with people and expect to get hired? No. Everybody's going to say all the things that they think these employers want to hear. When in actuality, what do employers want? They want you to come in with some skill, and then, yeah, something about yourself. Like, what other talents are you bringing over from where? For what transferable skills are you coming in with? You worked at the Dollar General, you worked at Walmart, you worked at wherever else, Costco or whatever. And, oh, okay, well, that's somebody that can handle cash if they were working as a cashier. So that means that they're trustworthy. If you were helping, with payroll, that's somebody who can be trusted with private information, because what is payroll? Payroll is addresses and phone numbers and social security numbers and all those good things, right? That, somebody who had, some bad plans could do a lot of stuff with that information. But because you are trustworthy, you were able to handle that and manage it, well, then that means that you are trustworthy, and they can trust you with this health information, because that's what they're looking for too. And you know how to protect private information, even though you've never been a medical coder before, but you have been exposed to people's private information. Oh, you see all these little nuggets I'm giving you? That's what you need to have on your resume. Okay. I give tips all the time, even though I'm a resume writer. But if you Google medical coding with Bleu, BLEU, resume tips, you'll see all of my videos pop up. And those videos have all the things that you need to tweak on your resume so that way you can go out there with a good resume. Everybody has the ability to write a resume themselves. Literally everybody. There's not one person that I can say, "Oh no, they can't do it." Yes, yes you can. You just have to think about what you're putting on this one paper because your resume should be on one page, not two. And you should have a cover letter. And that cover letter should have, all of the human element, not a regurgitation of what all the things that you have on your resume. It needs to be the human element. Like, this is what I'm coming in with, and these are my soft skills: organized, team player, all that. But that's the human connection, because the resume is for the facts. All right. So, well, let's see. How long have I talked? 41 minutes already? Jeez. Does anybody else have any questions? Because I'm not answering that last question. I'm not. There's 1,500 videos on my channel, dude. You can check it out. Nothing? Crickets? Cricket? Okay. Well, I have nothing else. But other than next year, 2026 is right around the corner. And when it comes to applying for jobs, make sure that you are applying. Even if they're asking for experience, you still apply anyway, okay? As long as a position is for a coder, you're going to apply. Now, if it's something else, some advanced thing, it's a lead or something like that, don't apply for that. But if it is for a coder, make sure you apply. Don't let the fact that it says, "Oh, candidate must have 3 to 5 years experience." That's the default. Everybody says that. Again, nobody wants to train. But if you show up and if they really need somebody, they're going to call the person who had the guts to show up. Is that going to be you? Alrighty. I don't know. Y'all are really quiet. So, I think that's it for me. Going once, going twice. Unless I lost signal. Alright. Oh, you too, Michelle. Okay. Thank you. Because I didn't know. It's like really quiet all of a sudden. I was like, okay. Nothing going on in the comments, so. Alright, guys. Well, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. Good luck on your searches, and I'll see y'all next week. Bye.